Good afternoon to you all. I'm Robert Bos, as Rajul was saying, working for the World Health Organization. That's the organization where you can only work if you can say trypanosomiasis, schistosomiasis, dracunculitis in one go. And I would like to complement this very interesting presentation by Per. We perform once every 4 years, so I'm happy that we're here together again after May 2006 when we were here. And that's where I want to start in my presentation. Where were we 4 years ago when we let off? Then I would like to focus a little bit on frameworks and models in the health sector and what their relevance would be to the issue of links between agriculture and health. Give you an example of a local perspective where agriculture, nutrition and health meet, and then again go back to these premises and look at what the opportunities are to do something in this field. 4 years ago, I had some key messages coming out of my presentation. The first one was about allocating resources to public health actions that by independent criteria are truly intersectoral, and Per just finished his talk on that, so that seamlessly adds to what you were saying. It's still not the case. Initiate a process of joint review, reformulation and harmonization of agriculture and health policies, because we do need that enabling environment to ensure that the two go hand in hand. Anchor the methods and procedures for health impact assessment in the planning of agricultural development. Similar to environmental impact assessment, health impact assessment provides a great context in which you can look at all the health issues as they relate to agriculture and agricultural development. Restructure and strengthen the health sector so that it's in itself more capable of interacting with the agriculture sector. I'm afraid that in the last 4 years that has sort of gone in the reverse rather than advanced from my perspective. And analyze and document the economics of joint agriculture and health actions as opposed to single action approaches. Economics, of course, is the basic decision-making criterion for all these things, and as long as we can show that it makes better sense economically to look at these things intersectorally, all the better. Now, this is the typical sort of WHO health sector slide that I would show to audiences looking at diarrheal diseases and water and sanitation issues, because of course in the health sector we tend to be very focused on death, and especially death of children under 5. You see that from the information we provide. What is the role of diarrheal diseases, typhoid fever and cholera in the generation of under 5 deaths, and also what can we do about it, as you can see from the publication last year by WHO and UNICEF, why children are still dying and what can be done. But I think from the perspective of agricultural professionals, there may be a much broader issue here. Dealing with death and preventing children from dying is WHO's remit. But if we want to get people from other sectors on board, we have to also look at things that are of immediate interest to their sector. And of course, first of all, there is the insidious impact of morbidity. It's not the 1.8 million children that die every year from diarrhea, or if you take the nutrition component with it, 2.2 million. But there's of course all those years of disease-adjusted life years lost because of morbidity, because of persistent worm infections, because of chronic under and malnutrition, well, and so on and so on, the chronic effects of exposure to chemicals, etc. And that brings the question, of course, to what is prevention, and we have debates on that all the time in the WHO, because as it is a health organization, of course, it's predominated by people from the medical profession, and many of those believe that the first order of magnitude is the one dealing with death. So when they talk about prevention, they talk about preventing children from dying. In the department where I am, which is public health and environment, we prefer to refer to primary prevention, which is really about stopping people from getting ill to begin with, or getting infected with infectious agents, or any of the other impacts of agents of disease. So there is this different perception in different parts of the health sector. And of course, that also leads again to the economics. What are the economic dimensions of managing the determinants of good health as opposed to the economic determinants of managing disease, either through vaccinations or through drug treatment or any other, or of course hospitalization and other typical healthcare services. And do emerging diseases, of which we have seen so many in the past decade, take prevalence over long-term health crisis to which we have become accustomed. We've lived for all our lives with children dying of diarrhea, of malaria. The figures always sort of stay more or less the same. And then, of course, new diseases come on scene, and we all of a sudden seem to be in a panic and expending huge amounts of energy and resources on those. 4 years ago, or 5 years ago actually, this framework was developed, and I would like to put it to you that we collectively, but also we individually, tend to be very good at capturing issues in these frameworks. It's a very good framework. It talks about the links between agriculture and health. It gives the concepts. It brings in comprehensively all the issues. But the question, of course, is where do we go with it? And I always wondered with these frameworks, what do all the arrows mean and why do they go in all directions? Because we do know that in the world, in the end, everything is connected to everything else, but we would like to know what are really the key issues and where you want to put your emphasis. Another framework, this is what I show when I talk about health impact assessment of development projects. And it shows that, you know, on the one hand, you have the impact of health policy on the health status of people through the health systems, the healthcare services, etc. But then you have a much larger chunk in society and in government, which is the development policy part, which often has much bigger resources available and which influences environmental and social determinants of health. Now, seen like this in a general way, it's a very interesting diagram, but probably is rather meaningless in contextual settings. So let's see whether by contextualizing it, we can make it a little more clear of what it really means when we talk about these interactions between health and environment. If we change development for agricultural development policy, then we can fill in those boxes of environmental determinants and social determinants by some of the key issues. And Per already referred to several of them. Intensified and expanded irrigation, and what does that do, for instance, to your vector-borne diseases? Changed livestock management, what is the distribution of livestock over time and space in a certain scheme due to the exposure of people to certain diseases? Chemical inputs, the introduction of new crop varieties, what does it do to diet, what does it do to other health risks that may be involved in those, or even mechanization of agriculture, where accidents and injuries may be at stake, but also in some places where cattle was replaced by mechanized agriculture, certain mosquitoes that prefer cattle actually started biting people and led to outbreaks of malaria, etc. And in the social determinants, improved land tenure, increased income, and with that often increased access to health services, and also enhanced farmer education. These are all determinants that then will influence health and will focus on, will have an impact on these 5 groups of diseases: communicable, non-communicable, malnutrition, injuries and accidents, and also the psychosocial disorders, which are often forgotten. But if you have a scheme where you have to resettle people, you will find that, of course, the communities that have to be resettled often suffer from psychosocial disorders. So that is another model, the health impact assessment model, that you could apply. This is a model that came out after the UNCED conference in Rio de Janeiro. It's called the Deep Sea model, and it looks at things in terms of how development through a number of steps actually influence health in the end. Driving forces, environmental pressures, the environmental state, human exposure, and then the health effect. And this is an interesting model because it then gives us an opportunity to sort of revert back and see what sort of interventions we can do at these different levels. Just to clarify, the driving forces tend to be things like population growth, economic development. I think now climate change is among those. Environmental pressures are production, manufacturing, consumption patterns, waste production and release, and all those forces and pressure then have an impact on the environmental state, natural hazards, resource availability and pollution levels, to which people may or may not be exposed. So with the state you have the hazards, with the exposure you then can determine the probability that the hazard has an impact and whether it is or is not a risk. And in the end then you have the health effect, so that's well-being, morbidity and mortality. Now when you look back along this chain of events, you can see that your impacts your actions can be different from depending on the level where you apply them, and also the involvement of the different sectors may then be different. So very much focused on health effects would be the health sector, which looks at treatment and rehabilitation of people. Human exposure already expands and gets into the area of health education, but may also bring in the educational efforts of other sectors, maybe agricultural extension, for example. The environmental state actually begs you to do something about environmental management measures. And of course, even further up the line, you can think about hazard management, and very high up where the driving forces are and where you want to influence those, you look at policy approaches that can be across all sectors and that will have an impact on health one way or the other. My final framework, and this is something that I think is one that offers a lot of opportunity. As you know, WHO is a normative organization, so we produce loads of guidelines. Our Director General is always complaining that we produce too many guidelines. And one of these guidelines is the WHO drinking water quality guidelines, which tended to be a very sort of strict global, rather static approach to giving guideline values of how water quality should be dealt with the result that many developing countries actually never used it because the levels that were put as guideline values were often too high for them to attain. So we've moved away from that, and we now have a more flexible approach, which is something that we refer to as water safety planning, which asks countries to set their own health-based targets for water safety that relate to their socio-economic environment. And then once they have said that, they look across the whole chain of events in water, drinking water, and in any other of these chains of events that have to do with environmental quality, and determine at each point hazards, risk factors, and what you can do about managing those risks, with the idea that as you go along the chain, you get an incremental risk management approach that in the end gives you, in this case, safe drinking water. Now, I've been reading about the value chains in nutrition and in agriculture, and I think that this dynamic approach that you are having there very much is compatible with what we're doing at this stage with our environmental health risk assessment and management. So it's a very interesting area to explore whether that's really true what I'm thinking, and whether we can actually link the two up, because that would really give us a platform from where we can change frameworks into action. Okay, I think that in view of the time I won't go into, but this is in any case what I've told you before about the health-based targets and the hazards and the risk business. I wanted to quickly take you to the field and see some of the issues as they occur on the ground. In this case, wastewater use in agriculture. We all know that freshwater resources are scarce, that rapid urbanization is taking place, that there's a growing market of urban workers looking for fast food, and that fertilizers are costly for farmers. These are all some of the drivers that I presented to you in the DIPSI model. And as a result, we see in many countries now around the world, and particularly in water-scarce areas, that peri-urban farmers and urban farmers are using wastewater for production. Of course, that has particular health risks, particularly of a microbial nature. So this is in Accra, Ghana, where it's a very informal way of doing agriculture, and where it shifts as the city develops into different areas, where women are often involved in actually marketing the products, and where, of course, the vulnerable groups are the farmers themselves, their families, but also the consumers of the products. At the same time, you see in a place like Ghana, and I'm sorry to show this to you right after lunch, but this is the way in Accra they deal with human waste that comes from septic tanks. Only 5% of the people are linked to a sewage system. There's also a large part that just practice open defecation, but for those who have septic tanks, these tanker cars come to this point called Lavender Hill. You can't deny that they have a sense of humor. And that is dumped straight into the sea. And of course, when you look at it from the health perspective, you think this is terrible because of all the contamination. Maybe, I don't know, from the agriculture perspective, you would say, what a waste of good nutrients that could go into an agricultural system. And then maybe slightly more organized in Senegal, next to Dakar, in the Pekin area, where farmers have sort of made holes into a big waste line that goes to a treatment plant, and they tap that wastewater and then apply it in a rather organized and cooperative manner to their fields. Now, all these people, of course, are exposed to health risks, and we want to make sure that they're protected from that. But we also realize that there are lots of health benefits coming out of these systems because they do add to the nutritional intake of urban populations. And as you can see around the world, there are plenty of cities. This is work that was done by IMI. Plenty of cities that either use diluted wastewater or polluted water or untreated wastewater in their peri-urban agricultural systems. Now, quickly to go back to those key messages at the beginning. Allocation of resources. What are the current possibilities to sort of do something about the need to get more resources for these intersectoral issues? First of all, a number of bilateral donor agencies have gone through restructuring. I'm thinking of Canadian CEDA, but also some of the Nordic countries in Europe, whereby they've done away with their sectoral structures internally, and they've moved to thematic approaches. And this might seem to be a new way of looking at development issues and bringing health into them, rather than before when there was a strict, health component in their program and a strict agriculture component. Also, there's maybe an opportunity to generate new and more compelling evidence for ministers who are really in charge of dividing funds over sectors. That's ministers of planning and finance. As we're doing now in the drinking water and sanitation sector, we would like to see the agriculture sector also to generate this evidence that can convince these decision makers to allocate funds specifically to intersectoral action. And finally, of course, that remains on my list, as always, mainstream health impact assessment in the investment planning for the agriculture sector. With respect to the policy business, the harmonization, I think that it's time that we look for a number of interested governments who would really like to embark on doing some of the action there and get some reviewing, reformulation, and harmonizing of these policies of agriculture, health, and nutrition done, and see how that works out. And then, of course, develop ways to translate those harmonized policies into functional institutional arrangements. The anchoring of health impact assessment I already referred to under the first point, but I think there's also the issue there of creating an enabling policy environment for HIA with institution strengthening and human resource development. And in some countries, we've been actually quite successful. In the Mekong countries, this is an ongoing process that we're working on. With respect to the health sector itself, as I said, there seems to be a trend towards a more sort of medical-centered focus in the health sector at the moment, but these trends always go up and down, a bit like a yo-yo. What we would want is that we boost environmental health and health promotion components in health sector program, and also that we generate evidence of how other sectors can assist in overcoming health sector constraints. Because let's face it, and let's not kid ourselves, the health sector itself has lots of problems with drug resistance, insecticide resistance, the flow of medical and health staff from developing to developed countries, etc., etc. And finally, analyze and document the economics of joint agriculture and health actions. Well, We need to get some economic evaluations on the way on this that look at singular and integrated interventions and compare them. And I think very importantly, we now almost for 20 years have the concept of disability adjusted life years, which the World Bank and WHO launched in 1993. And while it's now quite well adopted in the health sector, we're still waiting for its adoption outside of the health sector, and this would give the necessary information key to other sectors to say, you know, yes, we take the economic issues related to this serious. For more information, please go to our website, and I thank you very much for your attention.